What does the research say about cannabis, alcohol, and cigarettes in concussion recovery? Okay, so we're looking this week at ways to absolutely botch your concussion recovery. We're looking at ways to, if you wanted to guarantee PCS, this is probably how you maximize your chances. So earlier this month, I threw out a blog with my 5 kind of favorite ways that I see doctors prescribe patients and the way that I see patients sort of intuitively navigate their recovery in ways that is not so helpful, ways that tend to promote longer, harder, crappier recoveries. And you'll notice that in the blog, I didn't talk about drugs or alcohol. I didn't talk about that because I wanted to talk about this pretty interesting 2020 study looking at not a huge sample, 307 people at an emergency room concussion clinic where they tracked people's alcohol, cigarette, and cannabis consumption before and after the impact and how it impacted their recovery, their symptom burden, yada, yada. So this study was interesting. 307 people, we found that lots of people smoke, lots of people drink, and lots of people use cannabis. How did that impact their recovery? What we found is that alcohol didn't actually do that much. It didn't make the recovery worse. Cigarettes didn't do that much, didn't make recovery worse, and cannabis didn't do that much, didn't make recovery worse. It also didn't make it better. So the interesting part of that is if people didn't recover in a normal timeline, so people didn't recover in that 30 days, what we found is that cannabis actually made symptoms a little bit less, a little bit more bearable in that 4th week. And what we found is that cigarettes made the symptoms a lot worse, a little less bearable in that 1st week. So cigarettes seem to suck more acutely. Cannabis seems to be maybe a little bit better later. What is the takeaway? Is the takeaway that you should drink alcohol, you should smoke, you should consume cannabis for concussion recovery? No. What this study found is that it may not matter what Dr. Mark, what CCMI, what the American Sports Medicine Society is going to say is you should probably avoid drugs and alcohol in your concussion recovery. Let's backtrack a little bit. What do we know about cigarettes? We know that cigarettes can actually negatively impact TBI neurocognitive symptoms. This study even showed that in that 1st week, people had worse symptoms. We know that cigarettes are bad. It's 2020. We all know cigarettes are bad. Whether you're a smoker or not a smoker, you know cigarettes are bad. So the takeaway here is not that, oh, look, cigarettes didn't do anything to my recovery. Bigger picture, we know that cigarettes increase risk of cancer, cardiometabolic diseases, lung diseases. We don't like it. That's not helping your recovery. In terms of alcohol, alcohol is really interesting because we know that alcohol can actually increase your chance of getting a concussion. Alcohol intoxication tends to put you at greater risk of donking your head. The other thing to note is that people intoxicated with alcohol at the time of a moderate or severe TBI, so not a concussion, something worse, tend to recover better, tend to have less symptoms. And one of the reasons being is that alcohol might actually inhibit the glutamate excitotoxicity that happens in concussion. Interesting. But we also know that even light to moderate drinking increases risks of liver disease, increases blood pressure, messes with blood lipids, increases cardiometabolic risk. We know that many people, especially today, in the climate we live in with quarantining, with even not quarantining, pre-quarantine, with partying, things like that, people binge drink. They drink more than 5 drinks in a night in a confined period of time, and binge drinking increases all sorts of risks. It goes beyond just the metabolism. We've got increased risk of atrial fibrillation, intracranial hemorrhaging associated with alcohol. So I'm not going to recommend alcohol for people trying to recover from a concussion. The interesting note is cannabis. Cannabis doesn't seem to have a notable downside when we're looking at the neurologic research. Some of Dr. Amen's clinics, he's posted some SPECT scans that would suggest what I just said was wrong. I don't know. The research is not very conclusive on that. We do know that SPECT scans of cannabis users don't look as well as healthy non-cannabis users. But what we also know is that there's some growing literature that cannabis, THC, CBD extracts being used in TBI models, animal models, is showing promise. It's showing that it might actually be useful in mitigating excitotoxicity, cell death, neuroinflammation, things like that. What this study didn't show, that I'm talking about 2020 study, didn't show was that these people didn't improve faster. So cannabis might show promise in the future. It doesn't tend to show a harm. There is some evidence that particularly smoking cannabis, can have an acute sympathetic response. So we tend to see heart issues, increases in blood pressure, increases in sympathetics in some people from the THC really acutely. But otherwise, I don't know. So right now, take away this study just to wrap up. We're at 5 minutes now. 2020 study was looking at 307 people, their use of alcohol, cigarettes, and cannabis before and after concussion recovery, or before and after concussion impact. And did it impact their recovery and their symptom burden? No, it didn't. Cannabis may have actually helped the people with post-concussion in the later weeks, and cigarettes may have harmed the people a little bit more in terms of symptoms. So it didn't harm them, but it made symptoms worse in that first week. But otherwise, it didn't seem to do a whole lot at all. What are the takeaways for you at home? Don't take this study as a confirmation bias, as a confirmation that smoking alcohol and cannabis is good for your recovery just because it didn't change recovery. What I would still recommend for all of my patients, you shouldn't smoke in the first place, but if you do, there are resources to try and quit. I know it's difficult. I can't say I know personally, but do what you can there. Cannabis, cat's out of the bag, or not cat's out of the bag. The research is out, jury's out, we don't know. And alcohol, just don't do it. Don't drink alcohol for the 2 weeks after your acute concussion. That's what I got for you. But if you truly want to botch your concussion recovery, take up heavy drinking, take up cigarettes, and smoke weed till you float to the moon.